Ladies and gentlemen, welcome your hosts of Skinterviews, the expert series, George Skandalis and Nathan Strong.
Hello. What are we? All right, let's see. How's it going? Hello, everyone. Welcome to Skinterviews, the expert series. I am one of your two hosts. My name is George Skandalis.
And my name is Nathan Strong. It is so good to be here.
I want to clap for you. They're all clapping for you.
I love you too. I love you.
Hey, what about me? That's not fair. You got your wife and your kids in the audience.
I know. You know who else we have in the audience?
Who?
Our lovely executive assistant, Katerina. And can I tell you all, everyone, how long did you take to get ready today?
2 minutes tops.
Oh my God, this guy is the most high maintenance person.
You know, are we starting already? We haven't even started the full episode. We haven't started the season, and you're already, I'm not even allowed to say that word, on me. Okay? Let's just be nice. How long did it take you to get ready?
About 2 minutes.
Yes, that's as long as it took me to get ready as well. We want to welcome you all to Skinterviews, the expert series. We had a phenomenal run with season 1 and season 2, where we got to know our doctors personally, their life stories that led them to become the professionals they are today in the cosmetic, medical, and surgical space. But this season,
we're going to answer some questions.
And whose questions are we answering?
Your questions out there.
You wanted to know about what they do professionally, how their treatments work, what their actual advice is. Get more information than you could get from them on any of their social channels. And what I want you to be sure is to follow not only us on our social channels, which is skin.terviews, right? I got it right on Instagram. And Skinterviews by Nathan George on Facebook and LinkedIn. And of course, we're gonna welcome you all for this season to our new website, which I'm sure you're already there because you're watching it, except for the live audience here today. But it is at
Skinterviews.world.
We are taking over, baby. There's a fly in the studio. Who let the fly in the studio? Where's management here? Anyhow, I guess it's one of our competitors. They wish they were a fly in the wall. So,
we're about to bring these wonderful questions and answers to the safety of your own home for everyone to maybe be in your pajamas.
Well, they could be in a suit. What do you care?
Or they could be having popcorn on the couch.
Or they could be naked.
And what's our first episode going to be about, George?
Well, before we get to the first episode, don't you want to meet the experts?
That's a good idea.
So, we want you to get to know the experts because for this series, we traveled north and south, all across North America, East Coast to West Coast, and we handpicked 8 experts ranging from dermatologists to plastic surgeons. Are you ready to meet them? Here we go.
Hi guys, I'm Katie Bellesne. I'm a dermatologist practicing in Vancouver, British Columbia at Humphrey Cosmetic Dermatology and Seymour Dermatology, and we're here today filming season 3 of Skinterviews.
Hi, I'm Dr. Brent Howley. I'm a board-certified plastic surgeon. You are watching Skinterviews, season 3, the expert series. So I guess that makes me an expert.
I'm Dr. Doris Day. I'm a board-certified dermatologist in private practice in New York City. My passion is helping my patients look their youngest, most beautiful best.
Hi everyone, I'm Dr. Jennifer McIsaac, dermatologist and medical director at Ottawa Derm Centre in Canada's capital, Ottawa, Ontario. I'm board certified in Canada and the United States and have a fellowship in laser and cosmetic dermatology. I have the privilege of helping patients feel great in their skin every day.
Hey everyone, this is Dr. Daria Hamra from Nova Surgicare here in Greater Washington, D.C. area, Northern Virginia, Tyson's Corner. I'm a facial cosmetic and reconstructive surgeon, and I specialize in face reconstruction and aesthetic surgery.
Hi, my name is Dr. Sandra Nicki. I'm a board-certified dermatologist here in Toronto, Canada. My academic interest is allergy of the skin, in particular contact dermatitis. I love cosmetic dermatology. I love making women feel good about themselves and men feel good about themselves. I'm a best-selling author of a book called Beyond Soap. It's been published in the US, Russia, Vietnam, and Canada.
Hey babies, I'm Dr. Anna Guanche, board-certified dermatologist in practice in Calabasas, California at Bellesne Institute.
Hi, my name's Dr. Kunal Jindal. I'm a plastic surgeon in Toronto, Canada. You know, I feel very fortunate in life because I genuinely love my job and I'm very passionate about the work that I do, as it really affords me the opportunity to make a measurable impact in the way my patients look and feel, enhancing their natural beauty and really uplifting their self-confidence.
Big round of applause for our experts that are going to be with us for all 11 episodes of this series. And like we said, we're answering your questions. These are actually questions that our users submitted throughout the seasons of season 1 and season 2, things they wanted to know about. Today we're talking about the single-handedly most popular aesthetic treatment year after year that is continuing to grow rapidly. Once upon a time it was thought to be a little more taboo, and today the question really is, who hasn't had it done? We are talking today about neuromodulators.
Also known as Botox,
Dysport,
Xeomin,
Nuceiva, or Jeuveau, depending on what country you live in. And we want to know everything. That fly is going to piss me off today. Where's Catherine? Catherine! Hey, well, before I go with the fly, we want to know all about Botox. And see, if the fly did piss me off and I had Botox today, you wouldn't be able to tell, but I can still frown pretty much. Do you have Botox?
It's wearing off.
Okay, so we got to go see one of our experts. But before we go, maybe there's a few questions we should get answered. How many units do we do? Where can you inject Botox? What is considered off-label? Because we hear that a lot. But today we're going to learn all about that. Let's see what our experts have to say.
Okay, so let's break it down. What exactly is a neuromodulator? Let's say you want to frown. Your brain has to send a message to that muscle. So then it says, okay, I'm gonna send a message down this little neuron, and then there's these little sacs called acetylcholine. The acetylcholine gets released and it goes to the muscle and it causes contraction. When we inject a neuromodulator, what it does is it actually stops that communication between the nerve and the muscle, preventing you from frowning, flexing your bicep, or any other muscle in the body.
A lot of people don't know that before cosmetic use, Botox was used for probably 15 years to treat muscle spastic disorders, cerebral palsy patients, people have torticollis where their neck is stiff, spastic facial muscles.
So I had the amazing privilege of training with Jean and Alistair Carruthers, who actually pioneered the cosmetic use of Botox. And it's actually a really fascinating story. So Jean's an ophthalmologist, and as I understand it, in the late 1980s, she'd been doing some work with Alan Scott, who was using Botox to treat blepharospasm, which is this uncontrolled blinking or twitching of the eye. And Jean was using it as well, and actually one of her blepharospasm patients got angry at her for not treating between her brows because she had said it relaxed her wrinkles there. So the next day, Jean treated her receptionist for her frown lines and they saw the results. It actually took a few years to collect a larger group of patients. No one, of course, really wanted to be injected with a toxin. But when they presented the cosmetic use of Botox, people actually thought they were crazy, that this would go nowhere. And obviously, we know how the rest of the story goes. It's now a multi-billion-dollar industry, millions of procedures of Botox being performed yearly. So, you know, I think it's been a really interesting backstory to how Botox and neuromodulators came to be.
So here we are in 2021. If I hear someone say I haven't tried, especially if I haven't heard of Botox, it's almost like, wow, where have you been, right? 20 years ago, 30 years ago, this was a taboo thing. Nowadays, Botox is like, you know, brushing your teeth. Everybody has heard of Botox. Everybody knows what it is. Some people know how it works, and quite a few people have had it, used it, tried it, and they definitely know someone who has. Botox is commonplace every day. Everybody knows about Botox.
So in Canada, the most common brand that you may hear of is Botox.
Botox has that because it was the first. They paved the way.
You know, that's often used almost like Kleenex to sort of describe all the different neuromodulators.
Botox has the name footprint the same way that Coke has the soda industry, right? Coke is Coke. And to go up against Coke with a soda, you better have a real good strategy because it's commonplace. It is what it is.
But there are different neuromodulators in Canada, including
Botox.
Dysport would be the second longest. And then after that, we have Xeomin.
We have one called Nuceiva, which has a different name in different countries.
Jeuveau.
These are all, industry products that work very well.
Advil versus Tylenol is a very good analogy. Most of the neuromodulators are very similar to each other. And it's almost imperceptible, the difference in most cases.
Patients often ask, oh, I want this brand or that brand. Does it really matter?
The truth be told, I look at it, a lot of it is like Pepsi, Coke, ginger ale, right? They're all sodas. They're all great, depends on your taste. Any kind of neuromodulator that's used in Canada, certainly in our office, has to be Health Canada approved. It has to go all through the checklists.
But there are some people who don't respond to one, and you try another one and it works.
Each one has its own special parameters, and some of them are a little bit softer, some spread a little bit more, and these can be advantages depending on where in the face we inject it and how sensitive the person is to the neuromodulator.
There are some reports that some of them have a quicker onset. So instead of waiting 2 weeks, you wait 1. Some have a longer duration of longevity. So in other words, in lasting 3 months, they last 6.
There is so much artistry that goes into neuromodulators, where to inject, how deep to inject, and definitely each patient's anatomy is different, their goals are different, their budget is different, so you really have to adjust what you're doing. Each time they come in for neuromodulator, you look again at their face to see where they're moving because they may not need as much in one spot as another.
So we have to look at each patient individually, watching them naturally animate and then watching them and asking them to animate intentionally to see how the muscles move and to decide the best place to use this drug in order to have the most beautiful outcome that looks really natural and that also changes the trajectory of how you age. So it's not taking away movement, it's redirecting it to help you age younger.
A good injector is a term, actually, that only yesterday in the interview process with some nurses, I got rid of. I don't like the term injector. I'll tell you why. An injector is someone who takes an instrument and injects it. That is not what it is. I call it an artistic, an aesthetic technician, if you want, is a better term, an artist. Because an injector is purely just an injector. That is just the mechanical act of injecting something. I could give that to a 5-year-old, point the needle and shoot. To be a good injector, it starts from not so much the needle. I mean, this is very important, the technique and how we inject and where we inject and the angle and how much, but it's really about making that decision as to where are we going to inject, what are we going to inject, and how. And that is really the artistry of it. And it is not something that you learn in a course. You don't learn it on one patient. You learn it over time and you perfect and you change.
So you can't do a cookie cutter approach. You can't just do the same thing every time according to a grid like a robot. You have to really be an artist, and I do time and time, I even made a TikTok about it, I have patients that say, oh, there was a discount, down the street, or my friend was at a place and I said, oh, I'll try it, it's just Botox, and they were very unhappy. And it is depressing when you're not happy and embarrassed about the way your face looks, because neuromodulator isn't just about what you look like at rest. It's about what you look like when your face is moving. So at rest, you might look really smooth, but then when you try to emote, talk, or do whatever, your brows go up and all of a sudden they're pointed or they're too heavy, really low, and you just feel a lack of confidence instead of increased confidence with your neuromodulator.
The thing I want you to remember is when you buy a painting, what are you paying for? You're paying for the painter. You're not paying for the paint. Right? Nobody goes and ogles the Mona Lisa and says, oh, look at the oil paints, right? Facial injectables are no different. We sculpt the face. We augment beauty through shaping contours. Great injectors have an intimate knowledge of the anatomy and an in-depth understanding of beauty.
One of the things that really gets me so irked is when physicians sell product by the unit instead of understanding that they're offering their services.
Yeah, it's tricky because it's not about the units, it's about ultimately the outcome. And I think patients understand that, but there is a discussion often about what's the price per unit, how many units will you use?
So I always say I'm not a salesperson and I'm not selling you a product and I'm not a delivery man delivering it. I'm a physician who's aesthetically trained, and so this is why I don't sell by the unit.
I think we're trying overall as an industry to steer away from this, like, how much is a syringe, how much is a unit of Botox, and talk more about the overall artistry, the outcome.
I don't really know what it means to buy 3 units. I mean, where I put 3 3 units may be different than where someone else puts it. And so the value of that isn't by the unit, it's by the injector who's placing it as precisely as possible. So I may be able to get more out of less. And in that case, I don't think pricing by the unit makes any sense at all.
Patients want treatments to produce results. I don't think they ultimately, care exactly how many units are used and don't need to know that information as long as they have the result they're looking for. So if I'm using a few extra units in one zone and a few less in another zone, it's all going to balance out, because that's really what it's about. It's about balancing the function of the muscles that are going to pull and push various parts of the face in order to make the face look harmonious and balanced. And so really, I don't like to get into talking about units, and that's why I generally avoid unit-based pricing.
I get that question a lot from patients. How many units is too much? Patients don't have a reference. A lot of times the standard is kind of like 50 to 60 units, and patients have absolutely no context. They just go by how the number sounds to them, and they get scared. And I tell them, for someone that we treat hyperhidrosis, which is sweating, or facial pain and TMJ, they get up to 100 units, sometimes more. Compared to that, it's almost like half that dose. So it's always important to give a patient a reference or context so that they don't get scared unnecessarily. Everybody wants to be safe, so the first reaction is, oh, isn't that too much? They just want to be sure. It's kind of like their way of doing their due diligence.
Let's see. Okay, so glabella, probably looking at about 21 to 25. My forehead, oh Jesus, there's a lot there. Maybe 12 or something like that. The crow's feet, okay, probably 12, 15, somewhere in that range. I'm a guy, probably take a little bit higher doses than that, so give or take.
I would probably go 40, 60. I would say, George, we better clear up a whole bottle, because we're looking at least 100 units. And honestly, if you take a male, a muscular, fit male like yourself, you got to remember it's all muscle balance. See, the amount of muscle that I have in my glabella area may be much thicker, much stronger, much heavier than, a thin female. So if I take a male like yourself or like me, and I'm going to soften that muscle to the point that I'm now decreasing its function, it may take 40 units. I may need another 20 units in my forehead. We're at 60. I may need another 30 units around here. We're at 90. So real quickly, we can get to 100 units of Botox. But it doesn't matter, the number of units. And I tell patients this, I'm not here to inject you with 100 units or 30 units. I'm not here for you to have Botox and Nasiva. What I want is you to get the result that you want. That is it. I have had Botox. I had Botox in my glabella, my forehead, around here. I used to think that, my God, I'm always going to be 21. Unfortunately, I don't know what happened. The years kept rolling, and I didn't have it bad. I just had some wrinkles here, and forehead. It was amazing, really. I do it all the time.
At this moment, all of my neuromodulators have worn off, so I am due for them. And as soon as we're done, I'm gonna go in the back and get a syringe and take care of me.
I absolutely have neuromodulators in me at all times, in various places. I just do it judiciously because I do a lot of camera work. I like to be able to move my face. But yeah, so I can still move, but definitely not as much as I normally would. And so the lines don't crease as deeply as they normally would if I didn't use neuromodulator.
Why are people afraid of it? Beats me. It's an amazing drug. I'm being a little bit cheeky. The reason people are afraid of it is because you can walk down the street and see somebody a mile away that's been overtoxed, right? Their forehead is like crystal clear and their face doesn't move, and people are afraid of looking unnatural. But in actuality, those are bad jobs, not good jobs. And so that's not what the actual medication does.
There's nothing scary about it. Of course, anything in non-expert hands should be scary.
When I hear people haven't tried neuromodulators here in New York, I totally get it, because there's a lot of people looking awfully frozen walking up and down the streets of New York. I mean, the mask hides some of it, but you can see the parts of their faces that are exposed are just not moving in too many cases. And that's such a pity because we've come so far in understanding how neuromodulators work and a way to finesse them so we can redirect energy without taking away movement.
I think there's still a bit of fear. There's less fear than there used to be. I kind of, again, liken it to when hair dye came out in the 50s. They were like, whoa, like that's a chemical. That's really bad. It's no different. And now everybody, it's quite acceptable. And when it's done well, it really makes such a big difference. And that's one of the great things I love about doing cosmetic dermatology is you can really make people feel good about themselves without making them look weird or overdone. And I would say that most people that have Botox done properly, they look themselves just better.
The dosage is important because you don't want to completely paralyze the muscle. In some cases you do, but in most cases you just want to weaken the muscle because you want to prevent the effects of the muscle movement, which in the face is mainly wrinkle creation.
If they're averse to it just because I know some people say they want to look natural and it's not a natural appearance, again, I would say if done correctly and in the right hands and with good products, I think the appearance should be very natural. Nobody should know that somebody has a neuromodulator on board.
It's all about education. It's anything we don't know enough about, we're fearful of. So I have patients that are fearful of neuromodulators just because they don't know enough about it. They have some information that they either gotten through a friend, through some website or the internet, but they don't know enough in order to feel confident and comfortable enough to have it done. So it goes back to education, and a lot of things that we as doctors do, we educate our patients first, just like with any type of medicine or procedure. And once we've educated them about the benefits and the risks, then patients feel comfortable.
It's certainly something that people come in scared of, but I think they leave very comfortable with when they know the knowledge and education that we have surrounding neuromodulators.
I liken neuromodulators to vaccines. So if we take polio vaccine, it's a very nasty virus, but we take the whole virus and what we do in medicine, the old way of making vaccines is we sort of dumb the vaccine down. It's called attenuated. So when you're getting a vaccine, old-fashioned vaccine, you're actually getting a toxin or a poison if you want. Neuromodulators are no different. You're taking a part of the botulinum toxin genetic code, you're taking a very small part of it, and you're mass producing it in bacterial little factories, and it's sterilized.
It's not toxic like the word neurotoxin says.
That's the kind of analogy I like to use to explain the safety, and I think people get it.
I guess if they're on the fence about it because they're worried about safety, I would say, that really is a non-issue. The safety has been so well studied and well proven that I'd be more than happy to sort of educate patients on the evidence regarding safety.
It has one of the longest safety track records in medicine and aesthetic medicine.
I actually consider neuromodulators to be the safest drug known to mankind. That's my personal opinion, and that's my experience from over 20 years of studying this drug. There's no drug that's more published, more studied, better understood than neuromodulators.
After 30 years of research data, yes, people are still a little bit afraid of neuromodulators, some more than others, and it is surprising.
Neuromodulators have been around for a very, very long time. In fact, they were first FDA approved in 1989 to treat strabismus, mainly in children. So, if that's not sort of one of the safest things that I know, what is?
But there are still many people that are terrified of it, and the track record is really good. But of course, now we've had a setback with that one famous blogger that had an issue. And so that kind of thing can deter thousands of people from ever trying neuromodulators when generally they're very safe.
There was a recent case of this social media influencer who shared her botched Botox online, and it actually went viral. And actually, I reached out to her when she posted her video and asked if I could share it and sort of duet it on TikTok, Instagram, discuss what happened, because she experienced a rare side effect known as ptosis, where you actually have drooping of the eyelid. And this can happen when Botox is misplaced by either the injector or it diffuses into the eyelid muscle. And it's certainly not common, probably less than 1% of the time, especially with experienced injectors. But fortunately, Botox is temporary. It will resolve on its own. But of course, when it happens, it can be quite disconcerting.
The best thing about neuromodulators is that they're reversible. And the worst thing about neuromodulators is that they're reversible and you have to keep coming back to have the same effect.
Well, there's two different ways or cases of brow ptosis. One is a relative ptosis, meaning relative to where your brows are positioned based on your base muscle tone of your forehead. You know, our forehead has a muscle that keeps our brows in a specific position. That's a subconscious position, like we don't decide it, but that's based on the muscle tone. And so if you have already low set eyebrows and then you weaken the forehead muscle, what happens is that base tone of muscle gets reduced, which means the brow just follows the force of gravity and kind of goes down, which some call a relative ptosis, meaning relative to what you started off with. Okay, so that is a problem because it just makes you look tired. It makes you look, sometimes it makes you look like you're angry, but you're actually not. It just makes you look that way. And also, it gives patients like a headache because they try to lift their eyebrows because they feel like it's pushing on their eyelids and they can't open their eyes, and they try to elevate those brows, but they can't, so it gives them like this tension headache. So it could be very frustrating. The good news is, you know, after 2 months or so, as the effects start to weaken, it passes.
Ptosis is where your rectus muscle, which is the muscle that pulls your eye up, your eyeball up, is affected. So you have to be really making a big mistake or going too deep or going into a place I don't know where people have gone, because that's never happened to me. So not only will the lid be lower, but the eyeball will aim at a different direction and they won't be able to lift it up like they do in coordination with the other eyeball. So double vision is a side effect. Of course, it looks crazy because there's a light reflex in your eyes that they're symmetrical, and it won't be. And it can last up to 4 months. So, you know, there are some drops you can put in to help it, but it really has to be a time thing. And no, that's never happened to me, and let's knock on wood.
Complications happen. You know, in surgery, we say, if you're not having complications, you're not operating. Things happen, and it's important for your injector to A, know how to recognize the problem, B, know how to manage it, and C, know how to manage you and your anxiety surrounding it.
My mentor always said, if you do something long enough, these things will happen to you. If they don't happen to you, that means you haven't done them long enough.
One of the things that can happen with even the best injector is that it doesn't always go the way you planned. And so anyone who tells you they've never had a complication is outright lying.
So in my career, it's happened twice, and it's always friends or family. So I did a friend, and she went home and went to sleep. I told her not to lay down for 4 hours, and she went to sleep. And if you inject, especially around the brow area, and you lay down, the Botox can travel before it has a chance to bind to the receptor. And so that was not following the instructions.
I've had a few times in my 20-year career where the Botox may have migrated or the patient reacted differently than I expected, and they may have had a little bit of a droop of the brow. Fortunately, I've been able to adjust for it and also help the patient understand that this will wear off and it will go away. And all those patients are still my patients, and they're still happy with the treatments we've done since then. And it's only happened once to any given patient.
And sometimes there's patients that's very complicated. They're asking to eliminate their forehead lines, and they already have a low set eyebrows. Today, what I do to those patients, I tell them I wouldn't do that because the brow ptosis is going to happen and you're not going to like it, and you're going to have a better life or time living with those lines than having to deal with brow ptosis. So today, you know, based on experience, I'm very cautious and trying to educate the patient, because if someone comes to you and says, oh, I want to get rid of the forehead lines, and you say, oh, cool, yeah, I just inject Botox, and you don't know enough about the anatomy, about the aging process, and about how much the patient actually is subconsciously raising their eyebrows in a basal tone state, then if you don't recognize those things, you could easily cause brow ptosis on someone.
would say go to a board-certified dermatologist or plastic surgeon's office because they have the oversight and frankly, they have something to lose. If you just go to a Medi-Spa or a Doc in the Box or whatever, you don't have the level of care and the reputation that they need to maintain. You need to go somewhere where you can go back for follow-up if you need to, where they know what to do if something really happens that's not good. And you know, as we just said, Botox is not something that can cause permanent long-term side effects, but it can make you look really horrible for a good long time, and it's depressing. And so someone really needs to understand the anatomy. They have to be trained and overseen by a board-certified physician that specializes in cosmetic treatments.
A few years ago, there was a Time magazine article about Botox, and it was talking about how it's like the drug that's treating everything.
Botox and neuromodulators, they have tons of applicability around the body. In fact, when I was a plastic surgery resident, one of the questions on our board exam was list 20 non-aesthetic uses of Botox. So let's see if I can remember them. Okay, 1, hyperhidrosis. 2, migraines. 3, strabismus. 4, blepharospasm.
So with these neuromodulators, there are your gold standard treatment areas. Your glabella, your forehead, your crow's feet. Done. This is 90% of the use of these products.
18, lower eyelid spastic entropion. 19, gustatory sweating. 20, achalasia.
So as a matter of fact, I use neuromodulators to treat rosacea, which is redness of your skin, particularly in the face, that is non-responsive to alternative treatments like any specific creams or IPLs or lasers.
One of the places we've used Botox is actually in treating hypertrophic or keloid scars. And the studies show that they've shown marked improvement in scar width, height, vascularity, and the pliability. I mean, that's actually more effective than steroids. That's pretty awesome. And the whole idea is that the Botox reduces the fibroblast's ability to produce collagen.
There's a study published in 2011 by Stephen Dayan, who's a facial plastic surgeon in the Chicago area, who showed in that study that it can be used to reduce the redness and the rosacea of the face by injecting the neuromodulators very superficially underneath the skin, not into the muscle, but underneath the skin where those tiny blood vessels are that cause the redness of the skin. So that has been very successful. There's just no specific trials that would expand the labeling or indication for it, but it's effective and it's safe, of course.
Most of what we do in aesthetics is off-label, which means that it's not specifically approved for the areas in which we're treating. When we look at Botox in particular, it's FDA approved for between the eyes, the forehead, and the crow's feet.
So Botox or neuromodulators can be used off-label to treat a number of indications.
Many times it's become standard of care to use it in those areas. Like, for example, I've been injecting the crow's feet for about 20 years, even when it was off-label or not specifically FDA approved for that area. So we end up advancing how these products are used. Once they're FDA approved for one thing, we can use it any way we want legally in the US. The one thing you cannot do is use a product that's not FDA approved for anything on a patient in the United States. So if I took a product that's available in Europe, but it wasn't approved for anything here and injected it here, that would be not okay. But once it's approved for one thing, you can use it any way you want, anywhere you want.
So off-label uses of neuromodulator include Platysmal Bands. So I just did mine, so I don't know if I can pull them up for you, but you see these little stringies? What happens over time is that you keep pulling them up when you're talking and they start to stay that way, and you have little vertical lines in the neck.
So one of the places that we like to use it off-label is in the neck, and we call this the Nefertiti lift. Nefertiti was an ancient Egyptian queen from 1300 BC, and she was well known for her elongated, thin, beautiful neck. And so the Nefertiti lift really targets those platysmal bands in the neck in order to really improve those necklace lines and make a nice smooth neckline.
You can place a small amount of Botox just under the eyes to help soften some fine lines, and it can also minimize what we call the jelly roll, and it's that little pucker that forms under your eyes when you smile. And this can help open your eye aperture, make your eyes look wider when smiling, and so this is an area that some people really like to treat.
I like to use Neuromodulator basically anywhere that I think a muscle is contributing to a certain issue that a patient wants to address. So for example, common things that patients talk about would be something as simple as a bunny line. So a bunny line is still a muscle-related line that does bother people and is very easily treatable with Neuromodulator.
Also off-label, we use it for the masseter muscle. The masseter is for clenching your teeth, for grinding and chewing, but some people clench their teeth at night because they're stressed out. And so we can weaken the masseter muscle and make it softer. In high doses, we can weaken it so much that it tapers the face, because some people want a more heart-shaped face. So if you atrophy or weaken this muscle to the point where it becomes smaller, you can have a more heart-shaped face.
You can use Botox to treat, essentially when you see a lot of the gums when you smile above the teeth show, and you can drop that down a little bit.
So a lot of people who are just stepping into injectables like to evert or show more pink on their upper lip.
Using them in the calf muscles to, again, lengthen and soften that calf to give you that more slender, almost Barbie doll look to your calves. So, I mean, these are treatments it's truly amazing. Now, these are not the forefront of what it's used for, but certainly they have that ability, and this is where the creative artistry and almost the temptation comes in using some of these products.
I use it in Bella Micro Gold. It's a superficial, tiny treatment of neuromodulator to this whole surface of the skin, and it makes the skin look more perfect because it reduces oil and sweat production. That's one of the things it's approved for medically is hyperhidrosis, and so we can use it on the face in tiny doses, just going about 6 microns deep, not enough to change facial expression, but enough to make the skin look smoother. So in other countries, that's called skin tox. Some people refer to it as meso-Botox, and I call it the golden facial or Bella Micro Gold.
We should actually really do an episode on facelifts, face volumization, that kind of thing, because that's a whole different beast. But there's no question, neuromodulators, whether it be Botox, Xeum, and Dysport, all of them are fantastic tools in the artistry chest of facial aesthetics.
I mean, I've read a ton of studies on Botox. I guess I would say something that caught my attention because I didn't anticipate this was the effect of Botox on skin elasticity. So I didn't actually realize that Botox can make skin more elastic. I did not think, similar to the example of impact of Botox on vascularity, which we have seen in a number of studies, I really didn't even think that Botox could impact skin elasticity the way it seems to possibly be able to based on the evidence that we have so far. So that was very interesting to read about.
The one thing everybody's got to know is that these products don't make you look unnatural. From 2000 to 2018, there was an 845% increase in Botox use. What does that mean? It means it's becoming more socially acceptable, and therefore it's removing that social stigma. You know, before people used to be mortified to tell their friends about their cosmetic procedures for fear of judgment. And now it's almost something to show off. You know, oh, you got to go see my plastic surgeon or my dermatologist. It's kind of akin to saying you got to see my trainer or my hairstylist. It's becoming more of a household topic of conversation.
Again, if you go back to 1950s with hair dye, there's all about shaming, a shaming culture, like, oh, you shouldn't dye your hair in 1950s, oh, you shouldn't do this, you shouldn't do that. It's the same thing with Botox. I think that, I think it's great, and you should, as a woman, and be empowered to do what makes you feel good about yourself.
So not a lot of people know this, but Botox has been used in the treatment of depression. There's been numerous studies that have shown the reduction in depression with the use of Botox in the face by up to 50%. 50%, that's comparable to some other antidepressant drugs. The cool part is it's not because they look in the mirror and they see fewer wrinkles. It's because it's actually disrupting the facial feedback loop of negative emotions. And a person's facial expressions can really influence their mood. How cool is that? You know, with more than 250 million people worldwide suffering from depression, there might be a little new sheriff in town.
So welcome back, ladies and gentlemen. Thank you for watching today. Don't forget to follow us, skinterviews.world. Thank you so much to our live audience once again. It was
Wait. Coming up next week. Is it next week? I don't know. We don't know when it's coming up. But coming up, we're going to be talking about butt lifts. Woo!
See you soon.